Hey, I'm Ryder Davis, and I'm here to talk about mental health treatment options. It's really important to remember that there are a lot of treatment options available. So if you try one and you might not really like it, it's not a bad thing to move on and try another one. One option is medication, which works differently for everyone. Medication may really help your friend, might not really help you. And the same goes for therapy. Some people really like one-on-one therapy. Other people really like group therapy. So there are mental health treatment options available for almost everyone. Different things work for different people. Let's talk a little bit about therapy. One-on-one therapy has been a huge part of my recovery, and it was actually a huge part of my life even before I was diagnosed. And it's always helped me to talk to someone who is not part of my day-to-day life and who can just help me straightforwardly and only talk about me. Therapy is very different than talking to a parent or a friend because the conversation revolves only around you. You can be fully honest without fear of repercussions or consequences. I myself have had many different therapists, some of whom have worked really well with me, some of whom have not. I continue to see a therapist weekly, and it's a huge part of my recovery, along with my medication. After I was diagnosed with bipolar disorder, I was put on medication almost immediately, and I really struggled with medication. I kept having manic episodes, they would change the medication, I had another episode, but eventually I did find the right mix of medications to prevent manic episodes from happening to me. And while I've struggled with some side effects, ultimately medication has been a huge part of my recovery process, and I'm really grateful for my psychiatrist. There are a ton of options for treatment available out there, and even if you don't like one that you may have just started, there are many other options that you can explore. Talk to a trusted adult or your primary healthcare provider about what treatment options might be available to you.